Okay, well, let's go ahead and get started. It's always good to get started on time, so I'd ask people to sit down, please. All right, and I'd like to call to order the July 22nd, 2020 meeting of the El Paso County Board of Health. And I need a motion to approve the agenda, please.
So moved.
Second?
Second.
All in favor?
Aye.
So we have, again, the opportunity to use technology to have board members and others get together. So a few little instructions, housekeeping for the benefit of the group and those who are online. The instructions for the board members have been sent out in the packet, and we're using Skype technology today. If there's a problem, what I'd ask board members to do is raise their hand electronically, and we can address that. The other thing I'm going to do is specifically take a moment's pause between sections to see if we have any questions or comments from board members so that they don't feel excluded. Instructions for those in the room, those of us here at the dais, the microphones are a little tricky, so we've got to make sure you see the button there to turn the green button on, and it's best to turn it off if you're not speaking. And also to adjust the microphone so it's right in front of your face so we can all hear. And I will mention there'll be some time for public comment at the end. I see a number of you have signed up. And again, what we really appreciate are those of you who have written email comments in advance. I'm a particular fan of educators, being one myself, and those comments that you sent in by email were not only spelled and correctly and in the proper format, but very nicely written. So I would expect nothing less from educators. So thank you on that. And then before adjourning, we have an executive session that members of the Board of Health will talk about a property. So this has been a busy month for public health. It's been a busy month for all of us. And our director, Susan Whelan, and her outstanding staff have successfully brought our health department through these interesting times of the last month. And guided by three key principles that I'd like everyone to remember, and I can almost recite them. The first one is that our health department is data-driven and science-based, and that we use best public health practices. And as an example of that, I attended the NACHO, which is the National Association of City and County Health Officers conference this past month virtually, and one of the sessions was best policies for local health departments during COVID. And I was pleased and not particularly surprised to find out that our health department had completed every one of those. So as far as NACHO is concerned, our local health department is doing best practice here in El Paso County. So I'm very pleased about that. Let me open it up to Board of Health members. Any comments or questions to get started? Amy?
Thank you, sir. I just wanted to express my extreme appreciation for all of the health department members that are putting in incredibly long hours, led an example for sure by Susan Whelan, Executive Director. I also wanted to make sure that this board knew to express kudos to our own Susan Whelan for also being selected as Pikes Peak United Way's valuable community member. And that was announced about a week ago, and I think they got it pegged. And definitely saw beyond even just the work of late, but the work that Susan has done for a really long time for this community, and positioning the health department in a way to be as ready for this as anybody could. So I am honored to be able to congratulate Susan on that much deserved award and public recognition. And she's not one to let the public recognition come her way or to tell you that. So I'm bringing it up for her. So huge kudos to her there, and I know there has been a lot of work going on behind the scenes with my colleagues here as well, each of them working in different sectors that have some kind of an impact on how this is playing out in our community, and tremendous work really from all of our health partners, nonprofit partners, and community members. So we would not be able to do what we're trying to do for our community without each of those tenets happening in the community. So I'm just deeply appreciative, and I think we're on our way to. I think we're on our way to handling this and raising the bar for how it's handled across the country, right here in El Paso County.
Thank you very much, Commissioner Bremer. Any other comments from Board of Health members? How about remotely? Anyone want to lean in? Okay, so the next item on the agenda is approval of minutes, and that's an action item, so I need a motion to approve. If everybody's had a chance to look them over.
I'll move to approve. Second.
All in favor?
Aye.
Okay. Good. We heard remotely. Was that Commissioner Gonzalez?
Yes.
Okay, great. Good to know you're on. All right, well, I think the next item on the agenda is our June financial summary from Nikki Simmons. If you'd like to come down and address that, thank you.
Good morning, Board of Health members. Nikki Simmons, County Controller. I'm here to present to you your June 2020 financial summary.
We have a slide. There we go. Yeah, okay, thank you.
Oh, that's tiny, sorry. So for June 20, year-to-date through June 2020, you'll see that our overall revenues are below our anticipated budget by $372,000. Again, I'll repeat some things that I've repeated the last few months. This is not something that we're concerned about right now. Obviously, public health looks completely different than we anticipated when we passed a budget last December. And so while we are lower in revenues in some places for program-specific grants and other fees and services, our mission and actions have shifted to COVID-19 response and resiliency. And with that, we have all the funding we currently need in order to respond to that through 2020 and 2021. We have, right now we're utilizing numerous pockets of funding, and right now we're trying to ensure that we're utilizing the funding in the correct order and for the correct items. So we are utilizing FEMA funding. We are looking at the CARES allocation that the El Paso County has allocated to public health. We're also utilizing CARES funding that has been allocated through the Colorado Department of Public Health and Environment, and a few other grants that we've received to respond to COVID-19. So with that, there's no concern on our end regarding the revenues. Everything that we are doing currently is completely covered through one of those numerous sources of funding. In addition, our expenses, you'll note that it says that we are under budget by $384,000, but again, that has to do with that we authorize that $500,000 emergency reserve to be spent, which we are not intending to spend this year. We will roll that over to 2021 to allow our response to continue as long as possible. And so with that, I'm open to questions. Just a quick financial summary, because everything we're doing is COVID. Well, not everything. We're still continuing to run a public health department completely, but all the money changes are due to COVID-19.
Great, thanks, Nikki. Okay, Board of Health member comments, questions? Anything for Nikki Simmons?
Great, thank you. I appreciate you guys.
Okay, thank you. Okay, our Public Health Director, Susan Whelan, this is next on the agenda, please.
Good morning, everyone. We are going to do a COVID update as we usually do. We'll provide a status update and information on some data as to where we are. And then we will also dig into a mitigation plan, which we submitted to the Colorado Department of Public Health and Environment. The mitigation plan heavily relies upon mobilizing members of the public, numerous different partners, leaders, and the Pikes Peak, the Regional Pikes Peak Office of Emergency Management, as we navigate our way through this pandemic. So with that, I'll ask Dr. Johnson to come up and get us started with a status update, and then our Deputy Director, Deanne Ryberg, will review the mitigation plan, and we'll then hear from our Public Information Officer, Michelle, on the communication strategy. And what's really exciting today, too, we will have some members of our team, our partners with the Colorado Springs Conservatory, and we will also show a video that all encourages practicing of prevention measures, because we have some limited options in our toolbox, and this is a all hands on deck that I'm greatly appreciative to everyone who has been helping out, and we've been asking more and more members of the community and partners to help out, and I really appreciate seeing everyone in the audience today wearing a mask and doing it voluntarily and stepping up to do what they can to keep our community safe. So I am greatly appreciative of that. And with that, let's go ahead and get started. Dr. Johnson. We also have our Deputy Medical Director here, Dr. Leon Kelly, who has been heavily involved in this response all throughout, and he also serves as our El Paso County Coroner. So depending on what questions members of the board have, we have our team here, and we'll be happy to answer any questions.
Good morning. It's my privilege to be with you, Robin Johnson, Medical Director for El Paso County Public Health. I have the privilege of just kind of setting the stage about where we are, and then what are we moving forward with will be, I'll touch on the beginning principles, and we'll turn it over to Deanne to get into some more of the details of our mitigation plan, as well as then our communications and community partners, as Susan mentioned. I also want to just recognize that Stephen Goodwin is here. He is head of our data and analytics, and I have to just give a particular shout out for all of the beautiful data that we have that you'll get to ingest this morning. If you have questions, I'm happy to delve into it, but if it gets too technical, we'll bring Stephen down. So we do have that extra expertise here for some of those details as you may have interest. So the first thing I think we really need to note is that the U.S. is unfortunately in the lead here, and this is not a place that we would like to be. While we want to lead in many areas, we don't in the pandemic. While our numbers are continuing to increase across our nation, we see that we have been followed in these trends by Brazil, and they have begun to flatten a little bit. It's a little early to know if this is going to be a trend or it's just kind of like a little pause in their increase. But India is also beginning to, you can see their curve is beginning to move into that exponential growth, which is concerning that we have an ongoing growth across the globe. So when we look at the U.S., again, with the reported cases each day in the U.S. has been increasing. And there's been a lot of talk about that while the cases are increasing, we haven't necessarily seen hospitalizations. What we know about this virus is that there are time lags. We have a 2-week incubation, so from an event in which we would potentially be exposed, there's 2 weeks in which we'll start to see cases. And then after we begin to show symptoms of the virus, it's usually in that 7 to 10 day period that people begin to have enough symptoms and physiologic change that they would seek healthcare. And then once they begin seeking healthcare, those cases actually add up to the census of the hospital. So it's not just that you go in and leave, you spend several days to weeks. And the most recent data that I was hearing about, like our ICU stays, is it's an average stay of 26 days. So that vent is taken for 26 days each time a patient comes in. And so one of the things that we really concentrate on is anticipating from those early numbers what the expectation of hospitalization hospitalizations will be, so that we can be preserving and really moving forward with what we need to continue to care for our population. So our clinicians are looking at this not just for COVID, but how they will continue to care for us as a population, whether it's because we're having a stroke, we have appendicitis, we need to deliver a baby, or we broke our leg. So we really want to be cognizant of all of these factors. If we look again in the last 7 days here in the US, the majority of our cases really are being seen in that Sun Belt, down in Florida, Texas, California, and Arizona, and we've been hearing about this in the news. So it's really not any significant surprise to us. What stands out, though, is in the midst of that, New Mexico is kind of low numbers. And so really understanding is that due to some of their geography and social distancing. And again, Wyoming stands out. And if you've ever been to Wyoming, I'm originally from Idaho, we know that they kind of geographically do that physical distancing. And but yet it is important for us to pay attention, because there may be lessons learned here that we can extrapolate to apply for our own community. This is from the 14th. Unfortunately, this has not been updated on the CDC with recent changes in data. But what we see is that, as expected, again, our ICU beds are following those same trends that we saw in the case presentations across the United States. So let's dive right into where we are in Colorado. And what we see is that in mid-June, when we were applying for our multi-sector variants, we could see that we had really suppressed COVID and the number of cases we were seeing. We were on downward trends, and in particular, you can follow the dotted blue line, which is El Paso County, and we were at a low point. And you can see when we look at our dotted line that we were kind of a sinusoidal incidence, right? We would kind of tick up and then we'd come down, and then we'd tick up and we'd come down. And we were anticipating, as we began to tick up in June, that our hope was we would continue to that kind of motion of ticking down again, but we have not. We are now continuing to climb, and we have gone from being the lower portion of incidents across the state to the second highest if you look at this over the last 14 days. And when we look at it over the last 7 days, unfortunately, we have the highest incidence in the state per 100,000. So it is a warning to us, and we take this very seriously. And so with that information, we have been translating this onto our dashboard, and you can find this at elpasocountyhealth.org. We are updating this every day, and this is where Stephen and his team come in to make sure that the data is vetted, that it is timely and accurate. And we are updating it also as we discover other opportunities to really communicate with our population, so that people understand what is happening, but not only what, the whys, and then how they can really participate in what Deanne will be bringing forward in our mitigation plan. So when we look at this slide, it's particularly important due to the red, yellow, green lines that you will see on it. These have been set from CDPHE, and they have to do with viral load into the community and what we would expect to see with exponential spread when we start to cross per 100,000 people the number of cases, because these are active cases. These are not all-time cases, but the active cases in that incubation period where they are infectious and can continue to spread. We have moved from 1-to-1 spread or less to a 1.7 or a little higher spread. So for every time, like if I cough, 2 of you would get sick, if that kind of simplifies it. We have moved from our multi-sector variants, and you can see again mid-June that we kind of kissed that green line there, the one that we needed to be at to be really good, and kind of the expectation, because we know we have to live with this virus. We're not going to get to 0 at this point, and so we just need to stay at the green line or below. However, since that time, we have tracked upward, and we passed the red line in early July, and we continue to go. And yesterday, we were at 133 cases per 100,000. So we have seen some trends that are important for us to note, and that is that the trending has been that our demographics are younger. So our case counts are younger, and there is, I think we talked about this at a previous board meeting. I know that we've talked about that this population can actually tolerate the infection better without such severe disease. It is not completely benign. We still see hospitalizations in this, and we'll talk about that in a moment. We can still see some morbidity, meaning some kind of long-term shortness of breath and kind of malaise, fatigue sort of symptoms, and we're following that to see how long those last. This is obviously a novel disease, so we still have time that will tell how long those symptoms kind of bother our population. And what those sequelae will look like. However, what happens, and while we can tolerate it in the younger disease, at some point that burden of disease in our community tips over because it's just too great a spread. And so we have been seeing that trend, not only increasing numbers, as you can see from the bar graph, but also we're beginning to see it particularly impact the middle-aged group. So that 30 to 59-year-old age group. And with that, we're seeing, again, those hospitalizations increase, and we're beginning to see some increase in our fatalities. So again, this is our hospitalizations, and you can see that we're trending up. Remember, we talk about that it's not just kind of like you walk in and then you leave, but there's that census. And so we are beginning to see that our census has gone from maybe 2 to 5 through July of COVID patients. And this last week, it's been 40 and 50 patients. And so we can follow our census on our CEDARS, our CEDARS reporting system from the state. But we as El Paso County are really looking only at our El Paso County residents. Our hospitals are regional referral areas. So they receive patients who are needing that tertiary care from Teller County, down in the Del Norte area, all of southern Colorado. And so the impact when we start to see some increased cases is more than just El Paso County. And so we are working with our hospitals to really understand those pressures on them so that we can be cognizant of how we locally can help to support and get those messages out for our population to also understand. And again, our deaths continue among older cohorts, but we're beginning to see in that middle age that we are having some fatalities as well. And a lot of that is due to the comorbidities. However, we will see cases in perfectly healthy people where there's an overwhelming disease picture related to just the nature of this infection. It is more complicated, obviously, than just the simplicity of saying you need to be older to have severe course. So this is a really interesting slide, and it has become, I think, Stephen's favorite, if I may put it out there, because what we're doing when we're looking at here, basically, blue is good, orange is bad. This is actually our goal posts, right? This is where we want to go. We want to stay in the blue. And this is where, if we can get here, protect our neighbors, we begin to have increasing freedoms in economy, in connectedness, and things that help us to flourish individually and as a community. So when we look at our new cases, that's that top line, you can see that we have trended upward, and we're well above where we want to be able to return to the goal of blue. What is good to see here, though, is that the tests performed were in the orange, and we are now trending where we want to be, actually getting the number of tests we need to have a good sampling of our community and to be able to follow where the disease is spreading. The test positivity rate, what we'd like to see is that when we're testing this number of people, that we keep that test positivity rate under 5%. Again, that's a reflection of burden of disease in the community and how much of that can spread, and the fact that it will spread more rapidly. It's like salt being dissolved in water, and what we would like to see is that we could kind of pull the salty water into just a very small glass and have fresh water the rest of the way around. And at this moment, we're seeing that we're getting salt in most of the water here. Again, one of the metrics that we follow is the number of hospital admissions that are daily, and under 2 is considered a goal. And once we get over 2, that is considered to be in the orange. And again, that's because of the accumulation of these cases and what we would call a census in the hospital. And so as it becomes additive, that burden on the hospital system, the number of beds, the PPE that they have to use, all begins to go up dramatically. And so while we're tracking admissions, they will have 50, like this week, 50 cases of COVID, but they daily will have 10 or so who are people under investigations, that PUI that we talked about very early. And those patients are treated as if they have COVID till their test comes back. So again, just reflective of what we're doing with our resources. And this is another way of looking at our testing positivity. Again, it's on our dashboard. You can see the bar graph that indicates how many tests we're doing, and then you can see in the last couple weeks that we have really been staying above that 5% rate, that we have increasing distribution in the population of COVID and increasing burden. And while we have been doing better with our testing capacity, you can see that we lag behind the other counties. And so we are working with our partners, because we don't actually do the tests ourselves, but we are working with our partners to increase that access, increase the capacity, and continue to maintain turnaround times that allow us to do the epi investigation that's so critical to stemming the tide. So now that we've looked at the data, I just want to review very quickly what we know about COVID, and that is that it is infection that's predominantly spread through respiratory droplets. They leave our mouth and nose when we're infected, and they travel to others, and then they enter through the mouth or nose, eyes of the other individual, infecting the lungs. But once they get into the lungs, they actually have an endothelial response, which means they can affect other organs. So we know that there still is a need to keep our surfaces clean, because surface contamination does play a role, as well as some aerosolization, but those are smaller roles to that droplet spread that we've talked about. Most of those who do get infected do well, although you can see serious illness and death across all ages, and it truly is those who are older or with significant health problems that have a more severe course. And that has not changed over time. And the mortality, though, I really want to emphasize here, is not the only issue. So the morbidity can be a very real concern. We're beginning to see some trends in what we call long haulers, which is kind of like a chronic mono syndrome, and it tends to be in some of our younger individuals. And we see the Kawasaki syndrome in children, which is a higher incidence than what we've seen with other viruses. And it's older children. So we tend to clinically think of Kawasaki's in that, 0 to 5-year-old range, and what we're seeing in this is that it's kind of 5 to 12 is a little older age group. And so we just are really paying attention to those trends, making sure that we understand that we're following and getting those messages out through our physicians with their patients and awareness, but also to our public that this is something that we all have some skin in the game in the prevention of this. And then the contact, from the time that we have contact with somebody to the time that we have symptoms is that incubation period. It is typically 2 to 14 days. That is why quarantine is 14 days. And it is essential that we don't have the option to kind of choose on that. The virus really determines that it is 14 days. And typically it's right around day 5 or 6 that you'll see people start to have symptoms, but you can shed virus for 48 hours before your symptoms develop, which is again why we say quarantine is so essential if you've had a known exposure. And there are some who can never develop symptoms but can still be infectious. And we are still beginning to understand that more fully. And really at this point, it's that 2-day period before we see symptoms that we're able to focus on. But we don't want to lose sight that you can not have symptoms and still have the opportunity to spread the infection. So again, when there's isolation, because you had a positive test, even if you're not feeling that bad, you need to isolate because we know that you could be spreading the virus. If you have enough virus to turn your PCR positive, you can be infectious. So when we look at what are our options at this point to address COVID, there really are 3 that we think of in the infectious disease world. The first is prevention, and that is our really big tool in our toolbox. And I'm going to come back to that because I want to quickly touch on treatment and vaccination. And treatments we have, like for influenza, we have Tamiflu, and we know it's quite effective in decreasing the severity of your course of influenza as well as the length of time. We do not have that at this point for COVID. There are many treatments that are being explored, from Decadron to interferon. There was a small study out of Iran that came out looking at hepatitis C medications that have a pretty good safety profile, but it's not a big enough study for us to be able to apply it universally. And so those treatments at this point are really supportive and comfort care. We do know more about how to support people in the hospital. So like ventilation is much more gentle than originally thought because we recognize that this particular type of pneumonia responds differently. So our clinicians are continually learning and exploring this. We also hear a lot about vaccination, and vaccinations are essential tool in public health toolbox. We really promote vaccinations and promote the efficacy and safety of these. We are in the process of a race to develop a vaccine for COVID. You'll hear there's over 100 trials that are ongoing, and more and more every day are moving into their phase 2 and 3, which is actually very exciting, but it is yet to be available, and we won't be seeing that most likely till the earliest it would be early 2021. And so with that in mind, the other thing about vaccine is we will need to have enough uptake of the vaccine that we'd have herd immunity. With that in mind, we are really promoting that we vaccinate for those infections that we do have a vaccine for. So we will be talking with you and hope that you will join us in promoting our back-to-school vaccines to make sure that we're protecting our children from measles and other pertussis respiratory infections and things that could really impact their health, but also the influenza vaccine will be helpful and an imperative to keep our community healthy, keep our individual selves healthy, so that we have an immune system and basic health to fight off COVID if we are exposed, but also to minimize the number of other cases that are burdening our hospital and clinical systems. So let's go back to prevention, because that's our big tool. That is what we are promoting, and this is our call to action as your public health officers and team. We can alter the spread and contraction of this disease, and to do that, it's the same message we've been talking about, but we are really working to find the value proposition, the voice, the genre that speaks to every individual, because we know that the preventive approach only works with the accumulation of individual choices. While the disease impacts us individually, it is a public health issue. It affects us as a whole community. And so for us to really have that impact, every one of us has a job that we can do to really defeat our common enemy, which is this little teeny microscopic virus that we can't see and we can't know. The other thing is, it's not like I would infect one of you and you'd go home and feel ill and could say, yeah, that was Robin who gave it to me, right? It might be 5 days before you know it. And so then it's hard to kind of get that correlation about what are the activities that are risky for us. And so we are really working on helping our community and all of us as individuals to understand some of those implications. We're still wanting you to wash your hands, practice that social distancing. It's essential to stay home when you're sick. You can't, this is not one of those things where you go, well, I'm sure it's just probably allergies. We really need to be a little more prudent and think through what are the side effects or unintended consequences if we do miss it. Taking it outside. We know that being outside is safer than in, hence we're all wearing our masks inside, and those face coverings are essential. They don't 100% stop the spread, and however, they slow the spread dramatically. And you will see that there was, I believe, a bunch of data that was sent to you in a document for your review with the research articles and things if you want to understand that more in depth. And Dr. Kelly compiled that last week, so he can also speak to more of that if you have questions about the science behind it. The other one is that limited interaction or activities, because it is an accumulation of exposure that lends to infection. So we ask that you think through who your cohort is, the little pod or circle of 10 as we started, and how many and which activities that you do encounter. So this is our call to action. We're asking our community and you as our Board of Health to really bring forward the message that we are going to work together to defeat this particular threat to our economy, to our social connectedness, and our health. We will continue to test and trace so that we can control the virus. We are protecting our hospital capacity and working hand in hand with our hospital partners in getting those data points that can be meaningful to the public out so that there's understanding. We have our current variances and stages of opening that we are working diligently to protect, and working with our business partners to be good stewards of this resource that we work so diligently to get open in that multi-sector variance and our safer at home metrics. We want to preserve that and build on that so that we can move to a more robust economy and getting our schools open. And we are committed to the process of learning. We understand that schools are more than just the academics. There's the social, emotional, and physical well-being of our children. And so we want to work and are diligently working, and I know Dr. Kelly is really spearheading much of this with our school systems to find the best practices and find ways in which we can innovatively apply them to the different districts that have different needs. So there are two things we can do with our present situation: increasing numbers, increasing burden of disease. There is talk that we could go backwards with our variances and interactions, or even go all the way back to a stay-at-home order. That is our last-ditch effort. As public health, we really believe in the full human flourishing, and we've talked about our social determinants of health, that we have to have healthy economy, we have to have housing and food stability, and all of these other factors that really create the human experience and a vibrant community. And so we are asking that we capitalize on all of the opportunities we have with a universal and consistent prevention. And so with that, I am going to go ahead and turn this over to Deanne, unless you have questions for me at the moment.
Any questions for Dr. Johnson?
Dr. Turbush, I'd just like to make a comment. Really appreciate all the information that you and your team have gathered for us. With the ages, the 0 to 29, that's a pretty large spread. It would be interesting if we could look at 0 to 18, just to look at really the youth separately, then going all the way to 29, especially when we're looking at putting kids back in schools.
Yeah, there is some information that is coming out, and we have some data from the state that was very well done that we will be able to share with you. I was able to get that information from Dr. Early, and sorry, too many Erlings. So I can get that information out. We see that between 5 and 10, that age group particularly, so our grade school, tend to not, even if they do get infected, have really very mild and tend to not be as infectious. They tend not to spread the virus as much. And there's more information that is coming out in that arena. From 10 and older into that 18, high school, we see that they can have more robust course of this infection, and they tend to be more infectious. And so we're working with our school systems to delve into what the implications of that are and making sure that we're cognizant of some of those differences within that population. But we'd be happy to share that with you, and we'll continue to gather that data as we move forward to assure that we're staying on top of best practice and precautions.
Thank you.
Yeah.
Yes, Kari.
Thank you, Dr. Johnson. That was all very informative, but I do have a few questions.
Sure.
So I think I heard you say that the R0 number right now is 1.7
So we are trending upward towards that in Colorado.
in the state.
Yes.
Are we, it seems like we're also looking at another benchmark of 5% or less positive rate.
Yes.
So are we trying to get those numbers down?
Yes. So we want to maintain the same number of tests that we are doing, but actually see that we have less burden of disease, so the actual percentage of positivity would drop under 5%.
Okay. And I guess I'm just, how are we going to do, I know, you've talked about social distancing and wearing of masks, et cetera. Is the disease going to lessen somehow? I guess I don't understand how we're able to affect the R0.
So it's reflective of the spread and burden of disease. And so if we are making these choices that we have of prevention, we drop the ability, we decrease the spread of the infection. So if let's say I'm spreading right now and infected, we have a good 6 feet of distancing. You are wearing a mask while we're inside because we know that ventilation can increase some of that. And we're using hand sanitizer. So we're minimizing the ability for that to spread. The other thing is that when I'm not speaking in public, because we need to have the ability to see my mouth and for the communication, I'm wearing my mask. And so even if I were to have droplets, they are caught and they don't spread nearly the distance that they would, even if I were to sneeze, because we at least have a physical barrier here. Okay. So in doing that, we begin to decrease the number of people that I can potentially, in fact, if I feel sick and I decide to stay home, I'm not going to spread it to anybody. If I go to work and I'm hanging out with people while I'm feeling ill, have a fever, and I'm coughing, then everybody that I came in contact with would have more direct contact with the virus. I don't know that I'm...
No, I get it. And so are we doing that to stall for time until we have a vaccine? I mean, I guess what I'm trying to figure out is what our future is looking like.
Yeah, so one is that we need to be able to live with the virus in a robust way. And so if we are able to embrace some of these prevention measures, we can all continue to have interaction. What doesn't look like before, right? I mean, it's kind of the new norm. The goal would be that we eventually would get that R0 down low enough that it would either just become background noise and we won't see the spread, or it could potentially move out of the population. Now, only time will tell us about that, and so with that, we know that we have a better chance and a timeliness if we have treatments and vaccine. So I wouldn't say that we're stalling for time. I think what we're doing is we're practicing best public health, clinical health practice while we continue to build for other tools. And we're capitalizing on what we do know about infectious disease, the ways that we can, get rid of it. And it's like the sanitation, in our water systems for cholera. Right? I mean, it used to be if cholera got into the water, you just take the handle off the pump. Now we have ways of keeping seepage into our water systems. We have chlorination and all kinds of other tools that we add to that. And that is where our scientists and researchers are so incredibly valuable, because we have opportunities that we've never had before with our understanding of genomic sequencing and some of the points in which our immune system work that are, have developed so dramatically in this 21st century here.
Oh, thank you. That helped. I have a couple more. Is that all right?
Go ahead.
Thanks. I think I heard you say accumulation of exposure. So I took that to mean you might be exposed once and be okay, but if you're exposed again and again and again?
So some of that, there's kind of 2 points to that. And so the first one that I kind of think of is that circle of 10. Remember, we've talked about if you're going to hang out with 10 people, you try to keep that consistent, because if I'm hanging out with you, I'm exposed to not only you, but your exposure to your husband and your son. Infectious disease works in a social network. So if I hang out with 10 people at 9 and then 10 people, a different 10 people at 10 and another at 11, by the end of the day, I've hung out with 100 people. So my risk of exposure just based on probabilities goes up. So that's kind of that mathematical modeling.
Gotcha.
We do know that there is an accumulation, that infection is dose over time. So if I'm being exposed to more and more virus, that it can overwhelm our system. And yeah, so we just want to be cognizant that you are increasing, and I think the biggest issue here would be that probability of having a dose over time that then becomes infectious because of the number of exposures you have.
Thank you. Thanks very much. Thank you.
Director Whelan?
Thank you. I just wanted to add to Dr. Johnson's comments. Good questions, Kari, and I appreciate the clarification, Dr. Johnson. I wanted to make the point that this is a novel virus and it's new, and with the science we are learning sometimes weekly, this has been since February, since we've been working, I believe that's about 5 months nonstop, to do everything that we can as it relates to gaining objective data, learning all that we can, and then making a call to action to all members of the public, because we need everyone's help. And I think to your point, Kari, as it relates to the virus is not going away. It is real. It is an extremely big challenge, and we appreciate the questions, because as we learn together and as we work together, that's how we're going to get through it. There's not a lot of tools in the toolbox, and many of the choices that we have to make or have made are difficult as it relates to the ways in which we have to live our lives, to live with the virus. There has been numerous disruptions, and we anticipate that there will continue to be disruptions because we're dealing with different aspects every single day. And so I think that those are really good questions to clarify as we navigate through this. So thank you for that.
Vicki? Yes.
Thanks, Dr. Johnson.
Thank you.
I have 2 clarifying points. One of them you just said, I just want to make sure that we have it clear, and that was that we are not going to expand testing. We're going to keep the testing numbers the same, or with it being a call to action. I just wanted a clarification to make sure I didn't hear that incorrectly.
I'm sorry, I'm not sure I understood. Yeah.
I can take that one.
Yeah.
No, we need to increase our capacity. We are good on testing as it relates to some of the benchmarks. However, we are doing some work to increase capacity, and I think that that's important. We do have a couple of partners, UC Health as well as Peak Vista, who are doing testing, but that's part of our mitigation plan as well. The quicker that we can get results, the quicker we can act. And Deputy Director Ryberg will go through our mitigation plan and touch on different components of Kari's questions and yours as well, Vicki.
Yeah, thank you. And then I have just one more.
Yeah.
There's data is so confusing to the average person, including all of us up here. So thank you for explaining all this. One of the things that I'd ask if you could explain is the actual number of positive cases. Are they individuals, or are people double counted if they have 2 positive tests, if they're ruling out that they're over the disease? Are they counted again? Can you give some little clarification on the purity of those numbers?
Yeah, and Stephen, do you want to come, since you do all of that? I can speak to it, but I think that hearing from our expert would be great. And while he's coming down to answer that question, I'd like to, really acknowledge that this is, we call it COVID fatigue. And I think that we all have a little bit of soul weariness with the diligence that we have to maintain in this era of our pandemic. And so I think that having some compassion with the fact that this is not going away, that we are calling to action, which means each one of us has to participate. And that there are some days that, you just go, seriously, I would just really like to go out without thinking about whether I picked up my mask, and what that's going to look like when I walk in and out of the restaurant. Because, it's like traveling in a foreign country. When we travel where English is the primary language, there's a certain ease to that because we don't have to pay attention to everything because we understand and we filter that in our mind all the time. We are kind of speaking to some degree a foreign language today. And so all of us have a certain hypervigilance, which can be exhausting. And so really caring for our own emotional and that kind of weariness that we have for ourselves is going to be essential so that we can maintain it, but also having compassion with others as they are on this learning curve with us. And with that, I'll turn it over to Stephen.
Just to make sure I understand your question about double counting of cases. Cases aren't double counted. So while in the test world, the same individual could be tested multiple times and be positive, that happens. The same individual could be tested multiple times and be negative, which also happens. But in terms of cases, no, cases are very carefully counted. They're not double counted. When cases come in from different sources, they're identified together and the counts are cleaned out, so no.
Thank you. I just wanted to make sure that we had that clarification.
No, absolutely. And tests do go both ways. The same individual might be tested 4 times and then become negative the last time, and the other way goes as well. People who are being tested negative, then become positive. So, but individuals, no.
Thank you.
Thank you, Stephen. Yes. Any other questions for Dr. Johnson?
Dr.
Yes, go
Turbush, I have one, thank you. I believe it's important to have the capacity to do more testing, and we need to be doing more testing, especially with influenza season and cold season coming in a few months. And so are we going to have enough personnel to do testing in our community? Because I think if people get coughs and colds and influenza, they're not going to know what it is. And so I can see more people wanting to be tested. I would want to be tested because I wouldn't know what it is. And so we would need the capacity to do that with personnel and test, and then the lab capacity to evaluate. So
yeah, and to do so in a timely manner. And so one of the things that we know is that we want to be able to have resources that we can allocate specifically for our community and our state. When we have labs that we're using on a regional level, those labs are pressured by what's happening in the region. So if we're sharing a lab at this time with Texas or Arizona, their cases and needs are vying with ours. And so we have partners with CDPHE and with UC Health and others that we're exploring who have local capacity that really can respond to what's happening here in Colorado and locally, and we are working to capitalize on that. And it is complicated. I mean, we have to have the lab tools, right? And it's some pretty big, we're separating out DNA and then having to amplify that, and then we test it. It's pretty cool. But it is a big lift. And then we have to get the reagent, and most of the contracts require a certain amount of reagent to be prioritized to receive it. And so bringing those partners together to be able to have the bandwidth to get reagent, and then the swabs and the PPE and the personnel to run that. And absolutely, we are looking at all of that and working with our partners to continue to grow that capacity in response. And it would be, there's a lot of different ways we can use this test moving forward as we grow that capacity. And we also can begin to utilize, those other panels, respiratory panels. And so we're working with our clinicians, and we continue to meet weekly in the clinical ops group to assure that our clinicians are speaking around best practice and the screening of all of these others, and then capitalizing on vaccination to minimize potentially other respiratory infections that can complicate the picture. Yeah.
Any other questions for Dr. Johnson?
Thank you so much for your
you.
time and attention, and I'm going to turn it over to Deanne.
Good morning.
Good morning, board members. It's good to see you here this morning.
Awesome.
Good to see so many of you in person. So I'm going to talk a little bit about our next steps in our response. I'm currently serving as our Emergency Coordination Center Director, so many of these mitigation efforts then come to our team to help support and implement. As we talked a little bit earlier, we talked about frequency of exposure, repeated exposures, the impact of some of that on disease risk, and also helping our community partner with us in evaluating risk and taking those preventative actions that can help interrupt disease transmission. So you see before you something that we have developed to help our community understand the risks involved in various activities that they may be undertaking in the community. These risks are based on proximity, risk of exposure to multiple people, and how much risk may be involved in transmitting disease in our community. So you'll see there's certain activities that we identify as high-risk activities. Public transportations, bars, nightclubs. These are also some of the, when we talk about bars and nightclubs, these were some of the initial activities that were scaled back in our community because we know that they come with some high risks. And as you go down through that, you'll see some of the low-risk activities that are outdoor activities, exercising in our beautiful outdoors that we have here in El Paso County, and spending more time at home. So we hope that this will help the community. We have infographics available to help describe risks involved in daily activities. But as Dr. Johnson talked to us about the disease increases in our community and some of the questions about testing capacity, we have kind of a capacity vitals check. We're at a critical point in our response with cases increasing. So what does that mean in terms of our capacity to respond to that? Some of the challenges in front of us right now include our contact tracing capacity. With this rapid increase in cases, and our role in getting information to contacts quickly so they can take those steps to quarantine and interrupt disease transmission, we need to have the capacity to get that information out to our community so that they can take good public health informed actions. Currently, we are leveraging support from the state health department to provide the contact tracing and case investigation capacity, while our core team of skilled epidemiologists and disease intervention specialists are training up recent hires and additions to our staff so that we can have a more robust team fully leveraged to do those activities. We've also spent some time this morning discussing testing capacity. Testing capacity is not just what we have in terms of the drive-through lines or going to your physician's office to get the test. It's also the capacity of the lab to run those samples and have a timely turnaround so we can take those public health actions and provide good quarantine and isolation advice based on lab results. So we are seeing an increase in the turnaround time for those tests, and that is something that we are in communication with our partners at the State Health Department in regards to our partners in the community, and as you heard Dr. Johnson reference, we are working continuously to make adjustments and help expand that capacity when possible. Hospital capacity, we've seen steady increases in admissions over the past 2 weeks, and the concern with that and why we are engaging with our hospital partners around that issue is the strain on a regional healthcare system where it's not just our El Paso County residents who are coming into our hospital systems, it's also serving as a regional center, so we also have cases coming in from other communities. And again, that speaks to the complexity of this response, where it's not just a county response, but influenced by disease trends in the communities around us as well. And then we just want to spend a little time discussing what is at risk. We just have to look out across the nation and look at the news to see the trends that are occurring, not just locally, they're occurring regionally and across the nation with increasing case counts. And this is having significant impacts. We know that 23 states have either paused or reversed their reopening plans, and 28 states now have statewide mask mandates. That also impacts, as we try to mitigate this disease increase across the nation, many are rolling back their reopening plans. You see here a variety of impacts that are occurring across the nation, including restrictions on indoor dining, rolling back some of the elective surgeries, closing bars, and the impacts on hospital capacity as well. So looking a little bit closer about what that may mean for El Paso County. Throughout this response, we have been guided by goals of reducing disease transmission in our community to protect the safety and well-being of our community, of our residents, and allowing the critical activities that make a community flourish. That are the goals that drive our actions. So we have been trying to have this balance between our disease control measures and the flexibility and capacity to support economic stability and engagement in community life. So earlier in our response, when we had lower numbers, we sought and received approval for 4 variances. Those variances were to allow our El Paso County high school seniors to have a graduation, to mark that important moment in their lives, to open up our retail food establishments, because they are an important driver for our community, both in the economy, but also in the value of the community life that we enjoy in El Paso County. Places of worship. Always important in our community, but especially as we're going through a community crisis. Having that access to our houses of worship, that was an important priority for the community. The Cheyenne Mountain Zoo, it's a unique and special place in our community that we put forth a variance to support them as well. And a multi-sector variance that allowed further opening of and growth of capacity in our community. All of these variances were approved at a low threshold level. So I just wanted to take a moment to talk about what those threshold levels are. In the variance process that was put forward by the state of Colorado, the maximum capacities are determined based on a threshold. And at the time that we applied for the variances, we were in the low threshold approval. So that transmission level at a low threshold is less than 5% positivity rate in our tests, as we've already discussed this morning, and stable or declining hospitalizations. And as part of that variance approval and of this variance system for the state, we have an obligation that if we exceed a particular threshold that we were in and transfer into the next threshold, that we need to enter into a more formal stage of our mitigation efforts. So that is where we are now. We are in a more formal stage of our mitigation process where we are working closely with the state health department and our community leaders to put forward efforts to change these trends for our community. So when we exceeded that 5% positivity rate on July 8th, we did self-report to the Colorado Department of Public Health and Environment. We engaged with our partners, with our leadership in the community to discuss how we might mitigate this. And we worked on a mitigation plan that we submitted to the State Health Department on July 13th. And that mitigation plan, as it has been throughout our response, is informed by disease trends in our community. It is an ever-evolving document, and as we have new opportunities to mitigate disease, we will leverage that into our mitigation plan as well. Once we submitted that mitigation plan, we have 2 weeks to implement further mitigation activities. So that is where we are currently in this process. We are in the implementation of our mitigation efforts, and we anticipate that early next week we will have the opportunity to review our data with the Colorado Department of Public Health and Environment, assess what we have been doing towards mitigation, and from there receive any recommendations or changes that may be needed to our plans for the community. if we are not at pre-trigger levels, then we may have 2 additional weeks at a different maximum capacity or threshold level. That is part of the process that has been outlined to us by CDPHE. And after 2 weeks at that level, we anticipate that we will have further discussion with CDPHE regarding the feasibility of continuing with our variances. It's important to note that this is a very collaborative process with our community leadership, with the state health department, and none of the outcomes at this point are predetermined, but we will be engaging in many conversations and consultation with the state health department as we move through this process. So we wanted to talk a little bit today about the elements of our mitigation plan. As Dr. Johnson laid out for you, the interventions that we have to address the spread of COVID-19 in our community are somewhat limited. We are not at the point where we have early successful pharmaceutical treatment. We do not have a vaccine available to us. So it really comes down to the prevention and how we are able to leverage and engage around that. Engaging in prevention means that we need to have partners who come alongside with us to increase the messaging to our community, to implement best practices, and to help support us realizing the goals of mitigation for our community. We do have some partners here this morning that are part of our mitigation plan. They'll be speaking in a moment about their components of this. An important partner for us in these mitigation efforts as well has been our business community. You'll hear from them this morning as well about some of the efforts that they are undertaking to help mitigate disease spread in our community. Response capacity. From the initial stages of this response, when you as the board approved additional spending for FTE, we have been talking about capacity. So what has that looked like to this point? We have hired, or are in process to hire 6 additional communicable disease epidemiologists, 3 additional disease intervention specialists. We've hired some additional nursing staff. And importantly, we've also contracted with the Pikes Peak Workforce Center to have contract staff available to us to help us with those critical case investigations and contact notifications, because quarantine and isolation remains a cornerstone of this response, so that we can get people that good guidance, so that we can reduce transmission of disease in the community and have that individual engagement with people who may be at risk for transmitting disease in the community. So through the Workforce Center, we also anticipate that we will augment about 30 additional people to help with those case investigations and contact notifications. So building up that capacity has been very important to us. We are also building up capacity in our environmental health team, because certainly environmental controls and being a partner to our community are critical to this response. We're also augmenting our communications team. And then along with the lab testing, in late June, we also added a community-based testing site in Southeast Colorado Springs in partnership with the Southeast YMCA as well. Throughout this response, the mental health impacts and behavioral health impacts have been an area of considerable concern. So early on in the response, we partnered with UCCS Dr. Chip Benight to form greater resiliency intervention teams. So through this effort, the community is provided with access to trainings and free resources, and there's also a coaching program that people can go through to become resilience coaches and leaders for our community to help us navigate the behavioral health impacts of this response and this prolonged pandemic as well. And then an important part of this that we recognized early on was communication to the community, providing timely and reliable information. And with that, I'd like to ask our Public Information Officer, Michelle Hewitt, to come up and share a little bit more about how communications influence our mitigation plan.
Just a moment. Any questions for Deputy? Yes,
Thank you,
Dora.
Dr. Turbush. You had, on one of your slides, you had UC Health's capacity and hospitalizations, but you didn't have the Penrose St. Francis system, and I was just curious on where that is with that system in our community.
And I'm sorry, trying to navigate going back in the slides. Could you repeat the question?
That on one of the slides, it had the UC Health hospitalizations, I think, in capacity, but it didn't mention the Penrose St. Francis system, and I was curious about that.
So we are working closely with hospital partners from Children's, UC Health, as well as Penrose St. Francis to gain additional information regarding capacity within the healthcare systems. Those are ongoing conversations with our health system partners. And let me see if I can go back to that slide. So we did see some of our most steady increases in the UC Health admissions in particular. So we saw an increase in those that was communicated to us as we were moving forward with some of our planning efforts. They brought forward information regarding seeing an increase, as well as concerns for what those future increases may be. So that was some direct communication that we received from the hospitals. But we are also in constant communication with both Penrose St. Francis and Children's, as well as we work on increasing visibility and that information flow about hospitalizations in the community. This in particular was called out as a result of direct communication from UC Health.
I think I can speak to that. In the last several weeks, and of course before, there's been increased coordination, collaboration, communication with our three major hospital systems and increase in sharing of data. And I know Dr. Johnson, Dr. Kelly, others have led that effort. And I would say there is remarkable new transparency and cooperation amongst our hospital partners and with the health department. So I've been able to see real progress with that, and thank you. Do we have hospital partners here today to address this? Are there any members from any representatives of the three hospital systems?
They're not with us here this morning, but we are in routine communication.
Okay, Dr. Johnson, can you comment, please?
Yep.
So one of the things I think that we were calling out UC Health is that we did have a letter from the CEO of Memorial, our local UC Health branch, around his concerns with that increasing capacity. And we have been in communication with him, as well as our CEOs, we're always reaching out to and hearing from, Penrose St. Francis and Children's. Now, Children's doesn't typically have as much of a burden of COVID due to the fact that they are dealing with that population. However, they will be impacted based on overflow if we were to have to move into any kind of surge capacity. And we will be hearing more from our partners in that arena as we're working on creating dashboards that help us to understand. Because when we look at census and capacity and, baseline capacity versus surge capacity, it gets really quite complicated. And so we want to be very good stewards of what message we give, that it actually correlates with that clinical health and the clinical picture. And we have partnerships that are helping us to discern that. As you noted, it's increasing transparency and collaboration in making sure that our community is informed.
Thank you, Dr. Johnson. Yes, I think there's been real progress in that area. Perhaps for a future Board of Health meeting, we might be able to hear from, yes, Director Whelan.
I just wanted to add to Doris's question, one of the reasons why it's on the slide is because the high volume public facing drive-through clinics are provided by UC Health, Peak Vista, as well as we've established a partnership with the YMCA, and I believe that is through Dr. Johnson, Penrose St. Francis, or Betsy Klein, one of our clinical partners. But I just wanted to make that note that those are high volume ones, and we need to increase capacity, but that's why those are called out, because those are the high volume ones.
Great, thank you. Any other questions for Deanne or Dr. Johnson? Michelle?
Yeah.
Next? Yes. No? Okay. Is Michelle
And
next?
Dr. Turbish, public information officer, Michelle, is going to come up, but I know that we have some members of the Colorado Springs Conservatory, and thank you so much for being here. I know that you all need to leave, I think, about 10 o'clock to go back and help with some students, so we're going to change things up probably a little bit to make sure that they're keeping their other commitments, and we're just so grateful that you're here, and all of the work that we do with Linda Weiss, who is the CEO of the Colorado Springs Conservatory. We've worked on numerous different efforts in the community around prevention and teen suicide prevention, and she has responded in a big way as it relates to mobilizing some of her young adults and helping us be creative, and this is completely something that they had come up with to target the 20 to 29-year-olds, and I can't wait to hear from representatives from the Colorado Springs Conservatory, and I think that you will enjoy that as well.
Yes, good morning, board members. So we are going to change it around a little bit in order to respect their time. So I would love to call up some of our partners from the Colorado Springs Conservatory. They are an absolute creative powerhouse and have been working with us on some really creative and outside the box ways that we can look at reaching some of this younger demographic and helping that message resonate. So they have a couple videos, and then I would also love for you guys to introduce yourselves.
Can we start with the video? Is that cool? Is that possible?
Yeah. Carol Maskin. The pandemic ain't a joke. My neighbor's going broke, so it's up to all of us too. We got cases on the rise, but still out of supplies. We need to come together and it ain't about rights, it ain't about freedom. Everybody need to what? We're all going through so many tough times. Stay 6 feet apart in the store lines. Listen to the doctors and the experts, cause we all gotta flatten the curve. Submit your mask up challenge today. Get featured on countywide platforms. This is the truth of COVID. And we out.
All right, thank you. Yeah. All right, thank you. Good morning. My name's Jeff Grady. I am the lead mentor of recording arts at the Colorado Springs Conservatory. On behalf of Linda Weiss and the entire conservatory, thank you for having us this morning. We also wanted to thank Susan and Dr. Johnson for an amazing Zoom call we had last week, where they gave us some amazing information, kind of inspired responsibility about the pandemic in our specific age group. They also challenged us to try to brainstorm creative ways that we can reach the young people in our community through social media and different creative channels to share that message. At the conservatory, we believe we have an incredibly talented team of mentors, alumni, and extended fellow musicians and creatives out in the community that speak to the diverse population of our sector. We want to thank the board again for all your guys' hard work with this. We're excited to partner with you and do what we can. What you just saw is a social media dance challenge campaign that we hope to send out to all the young people and get a lot of the influencers in our community to grab onto this message and to repost it and really try to make a viral kind of campaign encouraging people to mask up. I'm going to introduce my colleague at the conservatory, Ian Gregory, next.
Hi, everybody. My name's Ian Gregory. I'm a mentor over at the conservatory, and I also run a local recording studio. And I've been a part of the community since 2007, so I'm definitely excited to be a part of this. So what you just saw was essentially a day's work, just us putting our heads together, being creative. We intend to produce a series of these pieces that all are kind of intended to reach different demographics of people. As Dr. Johnson was mentioning, a lot of the issue is in the younger generation, but obviously within that there's a ton of diversity, and we want to figure out how to best tailor those messages. So we definitely intend to do more of these kinds of videos with different styles of music, different genres, that kind of thing. Another idea that we're wanting to put in place is a series of PSA-style videos with different artists and influencers in the community, just to really help people understand how much this has all affected the artist community. As soon as things reopen, the sooner we can go back to actually bringing art and culture out there, and we believe that's so important. But obviously this is all just the beginning. We sincerely welcome any feedback that you have and just any advice, any other ideas, and we just want to figure out how we can best be of service. So speaking of artists and influencers, I'd next like to influence Terry Josiah Sharp.
Hello, good morning. Thank you for having us. My name is Terry Josiah Sharp. I'm the music executive at Anthem Music Enterprises. I was a mentor at the Colorado Springs Conservatory. And I'm also the senior studio manager at the Pikes Peak Library Studio 916 recording studio that provides free recording to the community in the Southeast. After our informative Zoom call with Dr. Johnson and Director Whelan, we all felt a deeper understanding of what it is or what it means to have this responsibility as music leaders in our community. And we wanted to make sure that we stepped up and masked up, and that we taught our younger community members and young community leaders to mask up as well, and to actually do something to combat this pandemic that's happening. This is our generation, and we understand how it is or what it means to be a good ambassador, and so we want to instill that in our young leaders as well. And working alongside community leaders such as yourself and these other incredible musicians and music and art leaders in the community, we just want to continue doing what we can to prevent the spread of COVID. And next up, I'd like to introduce one of the most artistic creators in our music and arts community, and Christina Wells.
Hi everyone, how are you today? Thank you for listening to us. Thank you for seeing this video. I hope you're excited as we are. To engage the community on this level is so important. I am a mentor at the Colorado Springs Conservatory. I'm also a local musician, very engaged in the artistic community as well as in the entire community, because I grew up here. You know, at the conservatory, we're huge advocates for community. We go to over 300 gigs a year just to establish the connection that we have in Colorado Springs, which is so beautiful. I have seen our community grow like crazy, even in just the last few years. That's why I know all of these amazing people, because of who moves here. And we are only growing in our artistic community and our restaurants and everything like that just now, right? So if it's as simple as wearing a mask, especially as musicians, where we basically had an entire summer of no employment outside of teaching at the conservatory, it's very important to us. And like we said, we have a huge demographic of artists that are willing to put in the work and serve our community in order to reopen it as quickly as possible. So thank you so much for your time.
Can we roll the second video, and then we'll just have it's the next one.
It should be that
one. Carol Maskian. The pandemic ain't a joke. My neighbor's going broke, so it's up to all of us too. We got cases on the rise, but still out of supplies. We need to come together and it ain't about rights, it ain't about freedom. Everybody need to what? We're all going through so many tough times. Stay 6 feet apart in the store lines. Listen to the doctors and the experts, cause we all gotta flatten the curve. Submit your mask up challenge today. Get featured on countywide platforms. This is the truth of COVID, and we out.
There you go.
Thank you. So that was a slightly different size, different format. Like we said, we're ready to create more of these videos. Hopefully this becomes an organic thing where young people are challenged to wear their mask, post a dance video. I don't know if you guys are familiar, but that's a huge thing right now. The young people they post a song, they all dance to it, and we're hoping to really blow this up and get people excited. With that, we just want to close with how can we continue to serve you guys in our community, and we're just curious if you have any feedback, questions, input for us as we continue this together.
Thank you very much. Appreciate it. Yes.
Thank you so much. That was amazing. And as they had mentioned, we had like a Zoom call, one evening till about 9 o'clock, and just talked about all of the prevention measures and how important they are. And they really, as they mentioned, that they were inspired in saying, how can we help out? And, I think what's important here is that, different age demographics and groups, different messages resonate with us. And this is really targeted towards that younger demographic, and this is just the start of the work with the Colorado Springs Conservatory on just one aspect of prevention. There will be many more to come, and I believe that this is also something on a social media platform, TikTok, that we're not on, but again, we're trying to mobilize all sectors and people of our community as we navigate through this pandemic, and this is just one example of a partnership, and I commend you all because I know that you work through the weekend and kind of brainstorming, and there's many more that are part of this and different jingles and genres that will be coming, and I can't thank you enough. I think the work that you do is incredible. I think that it will resonate and you will reach some people and create a movement also in responsibility and prevention and folks stepping up, and that's exactly what we need to do, and I greatly appreciate Linda Weiss and the incredible support that she has given us, and just really am grateful, and I appreciate you all so wonderful. Thank you.
Yes, Corey, go ahead.
I'll be quick this time. Thank you so much. I don't know if you were here when Dr. Johnson mentioned us being soul weary, and this helps my soul. So thank you, really appreciate you. Keep doing it. It sounds great. Thank you.
Thank you. I also just wanted to say, thank you for stepping up, answering the call, and asking what you could do. I think that is that really, in addition to the information you're providing, the public education you're providing, you're really also setting an example. You all introduced yourselves as mentors. You're absolutely not just mentors at the Colorado Springs Conservatory. You are mentors for our community, and an example of how each person can ask what it is they can do. And I just appreciate from the bottom of my heart you all answering the call in a way that only you can do. So thank you.
Good. I'm jealous of some of the moves on the video.
We can teach you, no problem.
Yeah, okay. Yeah, good luck. Okay, Susan, anything else?
Well, actually, I wanted to be sensitive to your time because I know you need to get back to the conservatory. So thank you so much, and we'll be in touch. But amazing work with, we went over all the prevention, spent some time, and this is their creativity, what they think is important to resonate with their demographic as mentors and help us kick up that prevention. So thank you so much. Have a wonderful day. Thank you.
Thank you, guys.
Thanks.
All right, well, I am certainly not going to be able to top that. So thanks for your flexibility. We are just so humbled by and grateful for these unique partnerships. So we'll just back up a little bit, following up on what Deanne had shared with the mitigation plan. So a big part of that is going to be the communication plan. And it kind of goes back to those key prevention measures that we've been talking about since the beginning. And I think it illustrates perfectly with the conservatory what our strategy is with some of that, which is to take these messages and package them and create them in different ways so they resonate with different groups, recognizing that what resonates with one audience may not with another. So as much as we can kind of collectively engage and create some of these unique strategies, it's going to allow us to communicate that message more effectively to our community. So again, just some of those strategies, we again are focused on utilizing all of our mass media channels, so everything from social media platforms to mainstream TV, again, using both English and Spanish. We're very passionate about including bilingual communication, and just leveraging all of our incredible partners to help amplify the message, amplify the voice, and help just get that out as much as possible and diversify it as well. So we'll hear from the Chamber and EDC in a little bit as well about some of those partnerships with the business community and public health. So I did want to touch on the Mask Up COS campaign and give a few updates on that. So since we launched this campaign at the end of June, as a refresher, it was something that public health and the city teamed up together to do as kind of a grassroots effort to give a little bit of the why behind wearing a mask. So to include different community members and have them explain why they believe it's important and why they encourage others to wear masks. So some of the updates on that are, we are thrilled to share that more partners have reached out proactively to join that campaign. So some of our municipalities, Fountain and Manitou Springs, have both indicated that they would love to join as well. We've had someone reach out from the University of Colorado, Colorado Springs, and also Colorado College, which is great because we're just starting to see some interest and buy-in, and people are really starting to engage. So public health felt very strongly about, in addition to sharing it on our social media platforms, we've also invested in some paid ads. So those will be running for about 8 weeks. And what we did with those was we took each of the separate graphics for each community member and targeted it to a specific audience, whether it's geo-targeting or to certain demographics, try and again help get content in front of people that will resonate more with them. So in just the first few weeks, we've been able to reach just over 45,000 people in addition to kind of our normal other communication efforts. We've also been offered 6 free billboard placements throughout the city from Lamar Advertising, so keep an eye out for those. I've got a link to a map of the locations. We'll also be featuring those ads soon on the creative outdoor posters on some of the trash and recycle receptacles around town. And then we've had multiple organizations and partners, including Harrison School District, that have asked for the collateral, so basically things like posters, and flyers, postcards, things like that to display and hand out to their families and partners and constituents. We've also got a local graphic design firm that's working on creating some window and sticker clings and kind of getting that out more and more and incorporating some of those values around respect and, again, why people wear a mask. And then we've also had some of our local media partners that have been running those PSAs as well. So we've really just been kind of focused on hitting all of those different platforms as much as we can and getting the message out widely. And then now I would like to call up Danny Barger with the Chamber and EDC. She is their Marketing and Communications Vice President, and she has been a phenomenal partner.
So, good morning, everybody. Thanks for having us today. We're very, very proud of our partnership with public health and working through this pandemic together. We know that in order to reopen our economy and stay open, we must communicate safety guidelines and best practices. So we've been partnering since the beginning, and I'll just go over some of our communication tactics. To begin with, we have 2 communications going out per week. One is a CEO letter from Dirk Draper, our president and CEO, as well as a general membership update. These reach approximately 6,800 business partners throughout the region. And we're frequently, if not always, reinforcing messaging, the latest guidelines and ways to engage the business community so that their employees can stay safe as well as their customers. We've also placed a guest column from Dirk Draper in the Gazette. This was done in late June, and this was 600 words talking about the importance of this relationship and calls to action for the community to follow these guidelines and stay safe. We also just wanted to reinforce that not only, public health's role in the pandemic is critical, but they've always been there for the business community. So we just wanted to, we really appreciate Susan, Dr. Johnson, Dr. Kelly, and the rest of the team. And then we're also engaging in frequent presentations with our board of directors, our board of governors, our high-level investors and stakeholders, and other partners constantly approach us for an update what's going on, and so we're always pushing the messaging out. Another project we worked on, so early in the pandemic, we developed some window signage for businesses, and the goal here is to promote consumer confidence. We want folks to know when they're entering an organization that these employers are following the guidelines, and we garnered some great media attention through print, television, and radio. These are available in English and Spanish on our website, cscedc.com, as well as through the Hispanic Chamber of Commerce. So these were also adopted by other community partners such as Visit COS Downtown and other local leaders. Then obviously social media is a huge component of getting the word out. So we've been promoting the Mask Up COS campaign, again, just various data points and other ways to practice social distancing and safety guidelines. We also curated a custom photo shoot just to capture businesses following the rules. We want to make sure that all of our marketing communication conveys that we're all doing the right thing and we're all in this together. Thank you for your time. I'm happy to take any questions.
Question? Thank you very much.
You bet.
So much. I'm happy to answer any questions as well. We are so grateful for those partnerships and recognize that economic health is a key component of public health in our community. And then we do have kind of a fun video to end with. That was something that our partners the Cheyenne Mountain Zoo shared with us about how they're doing their part to encourage mask use. So Blake, if you wouldn't mind playing that one.
Hi everyone, I'm Bob Chastain, President and CEO at the Cheyenne Mountain Zoo. First thing I want to do is thank you for purchasing a ticket to come and visit us at the Cheyenne Mountain Zoo. You may not know, but we're one of the few zoos in the country that don't get any tax support. So the way we support ourselves is you purchase a ticket and come and enjoy the zoo, or you buy a membership and come to the zoo, and I wanted to thank you for that. Second thing is, we know none of our animals like to wear masks, and we know some of you don't either. But right now, the Cheyenne Mountain Zoo is open because we partner with El Paso County Health, and we need to keep the infection numbers low in our county to stay open. Our number's on the rise. Currently, as I film this, it's 4 times higher than it needs to be. So we just have a few weeks to get those infection rates down, or the Cheyenne Mountain Zoo is in threat of closing again. So not only will you be required to wear a mask indoors via the new state mandate, we're highly encouraging you to wear a mask everywhere outdoors while on zoo grounds. Of course, if no one is around you and you're outdoors, you don't need to wear a mask. But the second you get in close proximity to any guests, we would love for you to put those masks on. My staff wears a mask 8 hours a day, so you could partner with them and help keep them safe, help us protect animals by wearing your mask. Thank you and enjoy your visit to the Cheyenne Mountain Zoo.
So I wanted to bring us back so the communication strategy is part of the mitigation plan. It's just one portion to support our mitigation efforts, and I commend our public information officer, Michelle Hewitt, and Danny, and there's also numerous PIOs and communication directors that participate in the Joint Information Center, which tries every single day to get out accurate, really robust information to the community as the information has been quickly changing. And so that is an accurate source of data that we work with all of our, community, our city, our county, for-profit, nonprofit communication folks within that. And, I did want to make the point that you were seeing a lot about masks, and that's extremely important. However, I do want everyone to know that we push all of the prevention measures in combination, whether it's washing your hands, staying home when you're sick, physical distancing, wearing a mask. It's all of those combined which will help us to navigate through this pandemic, and those are the options that we have right now. So I did want to let you know that, because a couple of these videos, they're focused on masks, and these are just a few of the examples of the numerous partnerships that we have and the actions that are being taken. As we had made a call to action a while ago, and we continue to do so. So any person, leader, business owner that has something at their disposal, we're asking everyone to step up and do what they can to take action on the prevention measures as we navigate our pathway through this. And as we learn what we have at our disposal, and I also see a strong member of our partnership too with Grade Line Buses, that I always see you at these meetings as well. And the more that we can demonstrate that folks that are doing the right thing, I think is really important, because sometimes you hear some about pointing out like who might not be doing the right thing, but there is an incredible number of people that are doing the right thing, and I really do want to highlight those folks in our community, and then also give some of those some grace as it relates to the different changing orders and information, and learning what that right thing is to do, and we're helping folks to navigate through that. So thank you so much. I appreciate it. And with that, we'll take any questions, and that sums up some of the highlights of our mitigation plan as well as our communication strategy.
Thank you, Director Whelan. We have a couple of board members dialed in remotely. Commissioner Gonzalez or Dr. Bucks, any comments or questions, please?
Yeah, Gonzalez, I just wanted to thank the staff for all the great work they're doing on the efforts and the numbers that we've seen, to help our community and all the community partners that were demonstrated this morning. I wanted to thank them as well. Thank you.
Dr. Turbush, I'd like to echo Commissioner Gonzalez, but also not trying to beat a dead horse. It is unclear to me whether the 50 hospitalizations we have at Memorial are all in-county individuals, or if that's our regional and plus a regional, and if it's not, if it's just ours, what is the regional burden on our systems? And then just to comment on that, something that Dr. Johnson said earlier about that physicians are hospitalizing and treating people based on symptoms and waiting for test results. It would seem to me those test results ought to be able to be done in a day, and given some kind of a priority based on the fact that hospital beds are critical and we need to have people with the right diagnosis. Thank you.
Thank you, Dr. Bucks. Two good hospital-related questions. Dr. Johnson, please.
Let me walk through these. So the PUIs are, so patients come into the hospital and there is a prioritization. Those tests are turned around in 24 hours. But while they are awaiting the test, they are being treated as if they have a positive test. So if you were symptomatic in the community and went through the drive-through test, we would ask that you would self-isolate until your test comes back. Because that's prudent, and that way you don't, get out a full 24 or 48 hours and go, oh, I guess I was positive, and yet I went ahead and went to the grocery store or whatever. So that is, they are doing a turnaround, but we not only are able to see how many patients are in the hospital with a positive test, but those whose test may still be in that 24-hour pending. And so those beds are treated as a positive until we have the actual defined test back. And so it just is indicative, again, of the resource utilization, PPE, and what is occurring with our staffing to make sure that we are mitigating any potential spread. And so as far as the regional burden, we know when we look at our Cedars data, and I think Stephen may be able to help us with some of this, but we're beginning to develop the difference between what we see in Cedars, which is just our El Paso County report out to public health, and then what the hospitals have as a census. And so we're assuming the difference between that are some of those regional cases that would potentially have been reported to Teller County or potentially out into Chaffee County, but those patients, so that they're counted as a COVID patient in the public health realm to that county. But because of the tertiary care that we have in the regional setting of our Colorado Springs partners, they would be part of our census at the local hospital. And I don't know that we have that pulled out specifically at this point, but it is one of those points of conversation because it is an interesting and I think very pertinent data point that we'll be wanting to track separately. Does that help?
Yes, thank you.
Sure.
Yes, Kari, you had a question? No? Okay. No? All right, thank you very much. Thanks for the director's report. Okay, we've been going at this almost 2 hours, so I'm going to recommend as a public health guy, we take a very short 10-minute break. When we come back, we'll do public comment. And I noticed a lot of people with red shirts. So I understand that that's Colorado Springs Education and many school districts represented here. Here's what I'd like to do when we come back is, first of all, I began this meeting by commending the two of you who took the time to write very informative, detailed, and nice emails, and I think that was very helpful. We do read those. The other thing that I would mention is that when you come down to make your comments is that the Board of Health members listen intently to what you have to say. My only request would be that you also listen intently to what the previous speakers have had to say, and maybe not say exactly the same thing. So, but we welcome public comments. We'll have a list down here if others want to sign up, and let's come back in 10 minutes. And again, please take your seats. And while we're sitting, I wanted to say that schools are a highest priority for our local public health department. And just this afternoon, Dr. Kelly, our deputy medical director, is meeting with superintendents in a meeting, and to begin listening to hear from them about what their needs are and do the planning necessary to get our kids back to school in the fall. So, yes, Susan?
I'd like to add to that, as part of the Pikes Peak Office of Emergency Management, there's a well-established structure, and since you all are here from the schools, I do want to let you know that there is a schools team that has different representatives on that team, and we do work with the Colorado Department of Education as well as the Colorado Department of Public Health and Environment, and we're not just beginning those conversations this afternoon. Our deputy medical director and our entire, our leaderships, we've been involved at some point in time, and schools is a high priority to us. So I did want to let folks know that as we have been working through the guidance and hearing the challenges and the concerns, and so I am grateful for everyone that showed up, and I think the engagement is good, and I look forward to hearing from you all.
Okay, so here's how we're going to do it, just like the county commissioners do. We'll go 3 minutes, and there's a timer, I think, somewhere above us. And we'll also, if you've signed in, you can speak. And while you're standing in line, I guess we'll take one from each side, alternating. And please try and maintain your social distancing. So with that, let's go ahead and begin. Is there any public comment? Who would like to speak first? Oh, yes, please identify yourself and who you're with. Thank you.
Good morning. My name is Carrie Fox. I teach 7th grade math and science at Challenger Middle School in Academy District 20, and I am the president of the Academy Education Association. I am here to represent teachers, paraprofessionals, bus drivers, custodians, and other educational support staff from Academy District 20. We ask that El Paso County Public Health set some minimum safety standards for districts and schools that they must meet before they may reopen 100% in-person learning, which is what has been announced by our district repeatedly. The COVID-19 school guidance that was issued this week, or last week, by your entity provides too much latitude for districts. Minimum health requirements, not recommendations, must be in place before a return to school is safely possible. Districts must be accountable for implementing these requirements and submit to inspections, like we do with the fire department, by El Paso County Health, so that we can ensure proper interpretation and implementation of the safety plans at the school level. Right now, there appears to be no oversight of these plans except for the virus itself. And when that happens, it's too late. Governor Paulus and Dr. Rachel Herlihy, our state epidemiologist, have told me in a video conference that they are expecting an increased incidence of this virus in August, when schools reopen. Colorado Department of Education is not considering district safety plans as part of district accreditation. El Paso County Health is recommending safety measures be in place based on the ability to realistically implement and adhere to measures while allowing education to continue efficiently, effectively, and safely. Because there's no basic safety requirements, districts are picking and choosing which safety guidelines to follow from your guidance document. Social distancing cannot occur when schools are staffed at a ratio of 30-1. And we are open at 100% capacity. Cohorting is in name only, and it looks great on paper. When students come to school on buses of mixed cohorts and then go to their classes. May I finish? Masks are mandated now, but once Governor Paulus' executive order expires, districts will be enforcing dress code violations instead of public health orders. And this is while there is a significant portion of our population against mandating masks for children. Regular testing for staff is not yet part of any plan for reopening that I have seen. You are essentially sending students and educators back to the same overcrowded, underfunded public education institutions. For me personally, that means 94 students in my current cohort, 26 kids in a class, 770 square feet of classroom with one window in a building 50 years old.
Okay, that sounds like a pretty good closure statement right there.
Thank you.
Thank you. Okay, let's go on this side. Yes, please.
Good morning. My name is Angela Byrd, and I am a teacher. I don't say this lightly because I truly believe that teaching is my calling. When I began as a teaching assistant in France in the fall of 2000, I didn't realize I would fall in love with teaching. It was just a way to get to France. But I did, and for my BA, I double majored in biochemistry and molecular biology and French. I fully intended to pursue scientific research and work in a lab. Instead, I bring a glimpse of the rest of the world to students in Widefield School District 3 by teaching French and science. For the past 2 years, I have had the privilege of teaching a course called Biomedical Innovation. One of the units in this course is epidemiology. While I'm not formally trained in epidemiology, I probably know more than your average American about how epidemiology works. I know how important it is to public health to limit exposure and to be able to contact trace when facing an outbreak of a potentially deadly virus. As president of Whitefield Education Association, I have a responsibility to make sure that as many educator voices as possible are heard on important topics in education. Nothing is more important right now than safely beginning in-person learning. The reality is that the majority of educators do not feel that it is safe to begin in-person learning. We feel the following requirements are necessary to begin in-person learning. Oversight by the health department of district plans, a checklist of requirements to safely begin in-person learning. Things like required PPE, required thresholds for closing in-person learning, and required maximum number of students per square feet in classrooms. Free testing for educators with direct contact to students, and to require all districts through a public health order or some other means to post in buildings and in their district website any positive cases of COVID-19 at that location. With the weak guidance from El Paso County Public Health on distancing in classroom, 76% of educators in Whitefield are concerned about the number of students that will be in their classrooms in the fall, and 74% feel that the ability to have 6 feet of distance necessary to begin in-person learning is not possible. When guidance documents state every bit of distance is better than none, did you envision classrooms of 35 to 38 students? When these types of statements are given as recommendations and not strong requirements, school districts feel that regular class sizes are acceptable. We urge you to have requirements, not recommendations, for schools to begin in-person learning. Thank you.
Thank you very much.
Hello, my name is Lisa Smith, and I'm not a COVID nurse. I'm a middle school band director. This is what I plan on wearing to school. I'd like to give you a snapshot into my day. I teach 6 classes a day. My smallest class is 27. My largest is 72. And I have 1,540 square feet in my room. I can't distance 72 kids on the best day. I certainly can't do it on the worst day. And those students will be blowing instruments with aerosol in my direction and in the direction of each other. I've been in my room all summer trying to stack chairs to figure out how I can make it work, and I don't know how. I'm able to hold a summer band starting next Monday. I'm super excited about it. So are the students, because you guys set guidelines for camps, and I use those guidelines. We're outside, we're distancing, we have measures in place. None of those measures are expectations for my school district starting August 19th. We're gonna have a successful camp because I was able to copy and paste your guidelines, and thank you for that, because we're able to be successful. This entire time, my goal has been, I can do that if, not I can't do that because. We can do this if there's safety guidelines. We can put one leg in the deep end, but we cannot jump. It will be several days before many teachers are out sick, and we can't be replaced. I know many people think we can be, but we're not replaceable. Our students love us, they miss us, we miss them. We want to go back, but we need some help. We need guidelines that are specific so that we can be successful. Thank you.
Thank you very much.
Hi, my name is Julie Jones, and I'm with Harrison School District 2. And I want to say that I thank God for the mask requirement now from Governor Polis. I think my district is doing the best they can to put something in place for us and for our students. We know that they have oftentimes unsafe home lives, and we need to get them back, but they also need to be safe when they come to school. And what I'm hearing from other fellow teachers in different districts is there is this lack of cohesion, that there is a lack of feeling safe. I feel frightened even being in this room for this long, I'm not going to lie. And I want you to take some things into account. The other women spoke so well to the classroom sizes, the amount of children in the rooms, our demands for requirements instead of suggestions and recommendations. But I want you to think about like some of the things I'm concerned about. When I hear epidemiologists say that the aerosols hover, and I go into a bathroom that someone was in the last 20 minutes and maybe they took their mask off, I feel unsafe. I feel very unsafe for the children when they go to the restroom, because my understanding is when you flush the toilet, particles disperse. When you use a hand dryer, things fly around. So one of the things I'm asking is, if we end up going in person, think about those things. We're going to need paper towels. Kids washing their hands and having wet hands actually keeps germs on their hands. So then I feel like I have to stand by the door and constantly squirt hand sanitizer, and who's paying for that? We don't know yet. So I would like to know that we have really specific safety measurements in place for everybody who works at the school and for all our children. And in our district, it's primarily Black and brown. They're at a higher risk. A lot of them live with older people. I don't want this getting out of hand and for us to be the litmus test as teachers and as students. Thank you.
Thank you. Go ahead.
Good morning, thank you. My name is Sandy Cook. I teach at Liberty High School, and I'm actually reading this for an Academy 20. And I'm reading this for another teacher who's at risk, and so it's a portion of his letter. He's been at Liberty for 18 years, and he discusses that to some degree, and then he does address the lack of staff voice in some of the decisions. The last viable concern I'd like to address in this letter is regarding the staff working with these students. We were not given a voice in any decision-making or opinion in creating this plan, nor were we offered a chance to teach online. That option seems to have been contracted out to other teachers who haven't been loyal employees to the district. If it's true, we now have enough devices to be a one-to-one district and the top-of-the-line LMS product of Schoology and professional development showing us how to be competent and proficient, there's really no reason other than political pressure to go forth in this unsafe manner. We can do it successfully online for a month or two, even 3. I believe we can go well into early 2021. And work in that until cases stop increasing, the curve lowers, and the students would actually have their own D20 teacher to help them. We can do it. I strongly urge you to rethink the plan to open in building until the environment is safer and with at least 14 days of no new cases in our county. Out-of-state districts have made this call, and of course DPS had recently shown fortitude in leading the way for Colorado with an intelligent plan to start online and then gradually open when the virus isn't on an upward dangerous trend. As a result, other Colorado districts are following suit. Please consider joining this cohort who truly have the best interest of their community, students, and staff in mind. Please abandon this plan that puts everyone in danger, and please move forward with caution by starting the year online with the kids' actual teachers. It's what our families, students, and staff deserve. So, thank you so much.
Thank you.
Good morning, board members. Thank you for giving us an opportunity to speak today. My name is Lynn Cito, and I'm a teacher in Academy District 20 at the middle school level. I've taught at Challenger Middle School for 8 years, and this coming fall I will be at Eagle View Middle School. I am also speaking today as a parent of 2 high school students who attend Pine Creek High School, aged 15 and 17. And I want to share with you first that recently our family had the opportunity to experience exactly what Dr. Johnson talked about this morning, when my husband was exposed to a COVID positive person at work in an office of 10 people during a meeting of 5. After that person tested positive, we began our own self-isolation and quarantine pending our test results, which took 7 days. During that time, the other office mates were also tested, and thankfully, no one, including myself or my husband, came down with this dreadful virus because that office had physical distancing in place. There was a minimum of 8 feet between coworkers during the meeting in which the COVID positive person potentially transmitted the virus to others. And so when I read the announcement that our school districts were preparing to open 100% online, I was utterly shocked at the lack of effort for physical distancing in our schools. And so I am here today to ask all of you to implement a requirement to that end. In my previous classroom and in my current one, the desks are 18 inches apart and there are 30 of them in the room. There is no way I can meet the CDE guidelines or the El Paso Public Health guidelines of even a minimum of 3 feet, much less 6 or more. In the high school where my students attend, the students are scheduled to attend 2 classes a day for 3 hours at a time in one room with potentially 30 to 40 students at a time if 100% of the students are there. You yourself just about 20 minutes ago said we've been sitting a long time and we needed to take a 10-minute break. Imagine a high school student, and especially one with special needs, being asked to sit for 3 hours a day in a confined, poorly ventilated space where they are potentially exposed to a high contaminant load from the virus in this classroom. Much less the fact that a 3-hour class is just an educational disaster. That's the attention span and infrequency of seeing your teacher, because you only see that teacher every 4 days, is just impossible. And so for the safety of myself, my students, my colleagues, and my children, I fervently request that this commission implement such a requirement, not just a recommendation or when possible, so that the cop-out that we just had not enough room to do it can be placed. I ask that you implement a mandatory 6 feet minimum separation between students during classes, so that way school districts are forced to become more creative for how we do in-person learning when and if it should take place again. Our restaurants are open at only 50%. Our libraries are only allowing 25 people in at a time. The same should apply to schools. Thank you very much for your attention this morning. Thank you.
Thank you. Before we take any more public comment, I'm going to ask that we not clap between speakers, and that's the way the county commissioners do it as well, just to make sure that we encourage all sorts of different viewpoints and not reemphasize certain ones. So, yes, please.
Good morning. My name is Shar Armstrong, and I'm a school psychologist in Lewis Palmer School District in Monument, Colorado. This Friday, if I choose to sign my contract, I will be starting my 19th year in Lewis Palmer. I'm here to share with you how concerned I am about the back-to-school plan that our school board presented on Monday night. The plan really isn't a plan, as it puts the lives of our students and our staff in danger. I can tell you that our buildings are not adequately ventilated. I can tell you that in the high school where I work, Lewis Palmer High School, we have almost 1,200 students that will not logically be able to social distance. I can tell you in my elementary school of 400 students that we do not have adequate space to socially distance there as well. Additionally, students need to commingle between one another during the school day and outside of the school day that will preclude them from keeping themselves and our school environment infection-free. I can tell you after 18 years of working in our district that I have never, ever been in a workspace or office working with students that has been deemed having adequate ventilation. In fact, half of our offices in the counseling center at the high school are inner offices and do not have windows. For example, on a typical day, whatever is going on in the shop area adjacent to me blows into my workspace. I smell sawdust, staining, and varnishing. Student body odors linger in my office hours after a student has left. We are being asked to leave doors open and to open windows if you have them. These are asks that conflict with our district security processes. I am now being asked to not close the door that provides privacy when I am interacting with students. We can do better than this. Would you please come and inspect our ventilation systems in each and every school in our district? The results need to be public information. Would you please provide accurate data regarding infection, hospitalization, death rates in our schools and our community, and make this a priority to our community as well? Our staffs and our students need to be able to make better choices about the return to school plan. There, I've said it, chronic illness and death. I have been a crisis responder for student and staff deaths for almost 30 years. Suicides, car accidents, low incident disability deaths. I dread, absolutely dread the day that I'm asked to assist in a crisis response for a student, colleague, or administrative staff member, knowing that it was our administration's recommendation that we begin school this way. The data suggests that things are escalating with the infection rates. Please help us keep our students, staff, and community safe. Thank you.
Good morning. My name is Melissa Ellenberger. I am also a teacher in Academy District 20. I am also a National Board Certified Educator. The current data of cases in El Paso County shows that the spread of COVID is on the rise at an exponential rate. When schools were closed in March, there were about 300 cases from March 5 to March 30th. In July alone, the case number has been over 1,300. 10% of these cases are children ages 10 to 19. To give an analogy, when schools were closed in March, this was akin to our school districts closing during a flurry, and we all make fun of them for it. We now have a blizzard. Why are we not closing during this blizzard? With the current mask order from the governor and the current mitigation plan that has been lined out, we will not see the results for hopefully a downward trend for at least 2 weeks. Next week, Falcon District 49 teachers return to school. What is a cohort for our school districts? There are schools that are planning on defining a cohort as the entire school of 600 or 1,000 or 1,700 students. This is obviously many more than a circle of 10 mentioned by Dr. Johnson earlier in this meeting. Citizens are being asked to continue social distancing and have a limited interaction with one another. Classrooms are packed with 30 or more students. Teachers have measured their rooms and tried to determine whether their normal student load would fit in their room. A classroom with 6-foot distancing cannot come close to holding the number of students a teacher's roster. And these students are not in a bubble. They go home with where their siblings have also interacted with their cohorts. An infectious student could knock out not only their own cohort, but also the cohorts at multiple schools. I have taught at all levels, kindergarten through 12. As a music teacher at the elementary level, I would see over 800 students at a 5-day period. Classes of 30 or more for 50 minutes a class. If I was an asymptomatic carrier or contagious, but not symptomatic yet, I could infect an entire school building. I had students with many underlying illnesses, including leukemia, heart conditions, a teacher receiving chemotherapy to combat breast cancer, severe needs students that would have 1,000 seizures a week. If I were to find that I had caused a fellow educator or student to become hospitalized or even die from COVID, I don't know how I could live with myself. There are many educators that are itinerant. They will knock out multiple schools in a day. Currently, I teach at the middle school level, and I see 300 students a day. What is my dose load of COVID? What could it be over time in this situation? I urge the El Paso Public Health Board to define how many students can be in a 100-square-foot area, define a cohort, and require districts to provide PPE not only for teachers but also for students. Please keep the students and school staff safe and healthy. Thank you.
Thank you.
Hello, my name is Ian Meyer. I'm a K-5 music teacher in Whitefield. I teach at Sunrise Elementary. I'm going to keep my comments short because I want to be to the point. You've heard from a lot of teachers today, and what we're asking for as a community is for your recommendations to become requirements. We really appreciate the work that you have done. Your recommendations are good, but we cannot have them just be recommendations. They must be requirements for the safety of our communities, and that's why we are here and why we will keep showing up for this reason. I want to paint a picture for you of what we're expecting if the recommendations stay recommendations and are not requirements. In the committee that I was a part of this summer to address music education, when we come back, we have predicted that we will come back for about a week, maybe 2. We will see a rise of cases, we will see death, we will see sickness in our communities, and then we will transition to online learning. That's one situation. The second situation, as you see with the unions showing up, is that if teachers are not willing to cause this spew of death and disease in our community, that you will see massive teacher strikes, walkouts, and problems of even providing education. That's situation number 2. What we're asking for is for situation number 3. That means that your recommendations become requirements, the districts are then held accountable, and we can do things safely in either a hybrid or a distance model until we see that the science backs us going back to in-person. You've heard about facilities. You've heard that this is simply not possible for us. So I urge you, thank you for the recommendations, now make them requirements, or else we're going to see massive walkouts and strikes, or we're going to see massive outbreaks in our community. We don't want that. We want to be with our kids. We want to come back. We want that third option where we can be with the kids in a hybrid model or a distance model to protect our communities. Thank you for your time. Please, please think about making them the recommendations requirements. That is what we're focused on. Thank you.
Thank you. I understand we have 2 virtual speakers. Is that correct? 3 now. Okay, please go ahead.
Hello?
Okay, hello? Go ahead and please let us know your name and who you're with. Thank you.
Okay. Hello, good morning. My name is Heather Bonnell, and I have worked as a high school science teacher in District 20 for 6 years. I'm calling in regarding concerns with our recently released reopening plan, as it appears that a lot of people are also talking about that. Before I get into all of that, though, I want to thank you at the El Paso County Health Department for your COVID dashboard. I really appreciate having all that data available. I like how you can look at several aspects of our epidemic all in one place. As a physics teacher, I appreciate the graphs and charts. I see several potential future lessons there. So last week, our school board released its reopening plan. It was met with horror by some, confusion by others, and probably glee by many that just want to get back to school. Make no mistake, teachers want to get back to in-person learning with students. As a parent of 2 teenagers myself, I also want them to be back in classrooms with their teachers and their peers. However, I cannot see how the proposed plan is safe. I'm especially concerned with the length of class times for high school, which are currently 3 hours, and the fact that these classes are called a cohort. Since students switch cohorts 2 times per day, every day for 5 days running, I don't see how this is called a cohort. I also feel that if I'm in a full class of 20 to 35 students for 3 hours in a poorly ventilated classroom, I will get infected. It's not a matter of if, but when, and how sick will I get. Combine that with my 2 daughters, also in this situation, and we feel a lot of dread about going back to school. The relative certainty that we feel about getting sick with this in-person arrangement is generating questions in our household about wills and plans for my kids if both parents get seriously ill. It is also making me question whether it's feasible to continue a career I love when I want to protect my family as well as I can. I don't feel like teachers should need to shoulder this burden without some help. I know several staff members who are purchasing face shields and air purifiers on their own. My room has no supply of hand sanitizer, and I have been told I will get 1 mask from the governor. I don't know if that's each day or for a week or maybe that's for the year. I'm calling in to ask you to create some firm oversight of the situation, and I've heard this from several other people today. We need clear rules about what PPE must be provided to protect teachers. We need to know when we would be notified of cases and how we would be notified. We need to know when community spread is too high to have schools open, and I personally feel we're already there, by the way. We need some rules about students per square foot. A full class of kids is just dangerous in this situation. And we need to know what is happening in our school and district regarding COVID. We need something sort of like a COVID dashboard for our school district so we can see, what's actually occurring. Teachers don't feel protected. We feel sacrificed and we are scared. We want a safe plan for school, and we have been largely left out of the process. We are relying on you to be the guardrails to steal school reopenings onto a safer path. We don't want to be part of an experiment with disastrous results. And right now, I am seriously concerned about my colleagues and how my family will fare. Thank you for allowing me to comment, and I appreciate all your efforts towards keeping our community healthy.
Thank you. Another remote speaker?
Hello?
Yes, please go ahead, identify yourself and let us know who you're with.
My name is Leah Reckless. I'm a teacher at Liberty
High School in Academy School District 20. Many of my concerns have been mentioned by fellow educators, so I would forego my comments at this time, but I thank you for listening.
Thank you. Do we have another remote speaker? We do. Okay.
Hello.
Yes, good morning. Please identify yourself and let us know who you're with.
Good morning. First, I wanted to thank you for the work that you do and for hearing my concerns today. My name is Diana Fricke. I am a District 20 parent and a teacher. I've shortened my statement in order to avoid repeating what my colleagues have said already this morning. As with many of my colleagues throughout the area have already said, I implore you to establish and require strict minimum standards for public schools to meet before they are approved to open safely for in-person learning. These minimum standards should be consistent with the other preventative measures recommended for all El Paso County residents. In the COVID-19 risk index that you have published, you list air travel as a very high risk activity because air travel involves, quote, enclosed space, prolonged close contact, potential clustering of people, and high-touch surfaces, unquote. This is exactly what our classrooms will be if you do not establish and require those strict minimum standards that we are asking for today. The fact is, it is extremely difficult for schools to keep students socially distant in the classroom. It is impossible to require face coverings while students are eating their lunch, and it is very disruptive to require frequent hand washing throughout the school day. But these difficulties are not reasons to abandon your Big Three health standards in our schools. If schools cannot provide a safe environment that allows for students and staff to practice your Big Three safety precautions, then we should wait until those Big Three are no longer necessary before we open schools to in-person learning. You must also realize that school boards and district leaders are eager to please taxpayers and voters. These decision makers are therefore unlikely to risk upsetting the status quo without strong guidance, requirements, and expectations from entities like yours, and I would actually guess that they are waiting for those. May I continue my last part?
Yes, please.
Thank you. Education, like some services like healthcare, can be accomplished in virtual learning environments. Please realize that temporary online education is an appropriate response to a pandemic. You have the power to limit the spread of COVID-19 in our community. Please do not allow school districts to pick and choose the guidelines that are easiest to follow. Please establish and require strict minimum standards of safety that schools must follow as we welcome schools back into our buildings. Thank you.
Thank you. Any other remote speakers? No? Did we miss anybody here in the room? Please.
Hi, my name is Javanka Mersman, and this is my husband, Dennis. We own a billiards league in town called the Central Colorado APA. We have been struggling because although the variances that are out there allow for sports league play, indoor sports league play, which is what we are dead in the water because we are not allowed to use pool tables. And all of our venues are either bars or taverns or restaurants or pool halls. And so we are obviously not doing anything. And so we've been waiting on the health department to allow us to use the pool tables. We filed a variance. We did get a response right away that said, we understand that there's a safe way to do this. We were very specific in what we outlined as far as social distancing, cleaning equipment, contact tracing. We could do all the things, but we just can't seem to get anywhere. And we understand that the numbers are going up. We're not ignorant to that. And we certainly have elderly parents, and heck, I have a daughter who's 8 months pregnant. So we really want you to understand our situation and, address our variance in some form. I mean, we're not asking it for everybody, but we're certainly asking for use of pool tables for our pool league. Sure, it would be nice if all pool players could access that, but for our business, our local business, it's really important to us.
My turn. All right, thank you guys for listening. Just to outline what we do for a pool league, it is a structured, organized event. Governor has made the comment that pool league is, just being in the bar, being in a brewery, it's a free-for-all. This is the opposite of a free-for-all. It is a pre-scheduled event, and let me lay it out for you. The bars that have multiple tables, in this environment, they're willing to close down every other table. A table by design is 6 feet away from the other table. Now we're going to be 12 feet away from each table. 2 teams consisting of five players per team, family and friends of 5 over here, family and friends of 5 over here, watching the 2 participants playing in the match. Again, by rule of playing pool, you need to stay away from your opponent while you're shooting, so there's social distancing right there. Players bring their own equipment. They're using their own pool cues. They bring their own chalk. In situations where somebody does need to use a bar stick, the bars are willing to clean those between matches. What else here? My wife mentioned contact tracing. This league is built for contact tracing. These matches are scored matches, so we know who played who at what time throughout every minute of the night. So should there be a problem with somebody contracting COVID, contact tracing is right up our alley. Let's see what else. Currently there is pool league play in multiple counties in Colorado, and definitely in the Denver area and the Fort Collins area, and I believe it's been cleared for league play in Pueblo County as well. What else? Again, I just cannot say it enough about it's not a free-for-all. We have a schedule of events. Team A knows when they're playing Team B on weeks in advance. They play their match. Again, I'm not ignorant. I know that there is some movement around the location in the bar and going to the bathroom and getting a drink and all of that, but we're going to absolutely encourage the social distancing, the wearing of masks, and all of that. Any more?
Nope, I think that's it.
Guys, any questions on the pool league play at all? I know it's kind of a unique situation. Okay, thank you so much for your time.
Thank you.
Yes, sir.
Good morning. My name is Chuck Murphy. I'm a business person here in Colorado Springs. And this is the first, although a lifetime Colorado resident, this is the first health department meeting I've ever been to. And this is where the action is. I mean, you guys have it happening here. And I want to thank you for all you do. It's so vital to our community. And I don't want to lessen that in any way. I so appreciate it, especially the preponderance of women on this board. I thank each and every one of you for being here. And I want to tell you, I went to my first county commissioner meeting 2 months ago. I've been to 4 of them. How often does the health department meet?
Once a month.
Once a month. So I thought that you guys just did whatever the county commissioners told you to do. So it's great to see a diverse group of people here that is independent from the county commissioners, yet has a county commissioners on the board as well. I want to state how much I like the little partitions that have been put in since the last week here, and how great it is to see smiling masks looking back at me. I do wish that we had the gentleman come over here cleaning the pulpit every time like the county commissioners do. How come the health doesn't have somebody cleaning it every time? It made me feel better. So listen, the reason I'm here is to thank you because of the hard work that you've done for our business community on trying to get variances to have us being able to be open at I'm the vice president of the Pikes Peak Regional Attractions Association, and how hard you work for that so that we could open up some of our attractions and get some of our residents back to work. How hard you've worked on the hotel and restaurant industry, and how sad I am to see all that work going down the drain with the numbers going so high, and to encourage you to do the right thing by our community and take the right steps to keep us safe. And to echo everything that these school teachers have to say. I am a resident of Colorado Springs at El Paso County. My kids went to school here. My wife is a substitute teacher. And to support our teachers as our students are the future. And how grateful again I am for you. Thank you.
Thank you. Okay, well, before we move into executive session, I wanted to thank everyone who spoke today and for your heartfelt comments. This next part will be moving to another room, just the Board of Health members. And for those of you who are dialed in remotely, it's not going to require a quorum, and this particular meeting is for informational purposes only. So with that, I'd entertain a motion to move into executive session, please.
So moved.
All in favor? Okay, thank you.
Aye. Aye.
July 22nd, 2020, El Paso County Board of Health meeting. I need a motion to come out of executive session.
So moved. Second.
All in favor?
Aye.
During executive session, no vote was taken, no decisions were made, and I need a motion to adjourn.
So moved. Second.
All in favor?
Aye.
Aye. Aye.